Good morning, and thank you for tuning into our webinar today featuring Dr. Alnami and Dr. Zaldivar. My name is Walter Guevara. I'm the Latin American Sales Director for Candela Medical, and I'm really excited that you are all here this morning and that we were able to restart our webinar series that unfortunately stopped when COVID hit. I'm looking forward to this presentation, at the end of which I'll be saying a few things about the technology and some promotions that we have with our distributors, and that hopefully will help you to look at this technology. We're very excited. And with that, I want to introduce, to begin, Dr. Firas Alnami. He has been a great friend to us and a great speaker for us, and I've learned a lot with him. And when I had questions that needed answering, he's been a great resource. So with that, I will introduce him and let him begin.
Thank you very much, Walter, for the kind introduction. And good morning, dear colleagues and friends in Latin America. I understand and I very much appreciate that it's very early in the morning. So thank you in advance for taking the time to listen to this. The reason why I'm actually very excited to give this talk is that because many of you know me from the pulse dye laser talks and talking about the V-beam technology in particular, which is one technology that's very close to my heart. But what has become apparent for me traveling around the world and giving lectures in lasers is that the NDYAG as a wavelength, as a laser, tends to be ignored and neglected. For some reason, it seems to be just unloved. And it's actually a shame because it is not that hard to understand. And once you master it, and once you use the NDYAG, you'll find that actually it does much more than what most colleagues think. So really, what I would like to do over the next 45 minutes is just give you a taste, give you an introduction, just try and enthuse you with regards to what the NDYAG can do, and hopefully you'll be able to incorporate that into your clinical practice. So just a little background about me, because you might be wondering, if you are in Latin America, why will you be listening to an Englishman across the ocean? Well, first of all, I trained in London. I have done a lot of work and academic work, but most importantly, I'm a friend of your continent. I'm a friend of Latin America. And I can justify that by showing some images. I mean, look at, the warm reception I have. This is in Mexico, and that's me in the Mexican costume. But this is Panama, again, with some of the esteemed colleagues in Panama. And this is me in Argentina, and I would like to thank NDYAG for inviting me and for all their logistical support. I've also been to Brazil, and I would like to very much thank Alvaro and his team in Brazil for their kind hospitality. I've also been to beautiful Paraguay in South America, and of course, Uruguay. So, I have traveled a bit in your continent. I love your people, I love your culture, and I'm one of your friends. So with that, I'd like to start really talking about the NDYAG. And I think the simple way to start is by just posing the question, what can the 1064 NDYAG do for your practice? Now, if I will ask most colleagues this question, even here in London, I will get one simple, straightforward answer, and that is hair removal in skin types 5 and 6 and leg vessels. That's most likely the answer I will get, but this is just a fraction of the truth, literally a fraction of the truth, because you're going to be seeing that the NDYAG can actually do far more. So let's start. If we just focus on one device from Candela, which is the Gentle Max Pro. As you know, the Gentle Max Pro is a dual wavelength platform. It has the 755 alexandrite and it has the 1064 NDYAG. Now, we all know that the alexandrite 755 is the gold standard for hair removal in lighter skin types, and also you can use that for benign pigmented lesions. But if you look at the NDYAG part, the 1064, not only can we use that for hair reduction and vascular treatment, but it has many other applications such as rejuvenation, diffuse redness, acne, and also onychomycosis, which there's an entire section presentation at this webinar which my colleague, Dr. Zaldivar from Mexico, will going to be presenting. So I will not be covering onychomycosis. And if we talk about the Gentle Max Pro, just to give you an idea about what it can do, if you just look at the spot sizes, and you can see that you have a wide range of spot sizes, and that's important because, for example, we have the very small spot size 1.5 millimeter, which you can use in the NDYAG, perfectly well suitable for facial vessels. So you don't need to worry, because this is the other concern, is people say, I am worried to use the NDYAG on the face. And yes, you might be worried using a 5 or a 7 millimeter spot, but for discrete small telangiectasias, using the 1.5 millimeter spot is absolutely perfect for that. There's also the 3 by 10 millimeter elliptical spot size that you can use for example, leg vessels. But if you're using it for hair removal, you can also use a very large spot size. The other important part is that you have different pulse durations, and you will see in my presentation why that is important, is that you can actually go to a very, very short pulse duration within the NDYAG, below 1 millisecond, which is the microsecond mode. And actually the microsecond NDYAG is the one mode that excites me and excites many other colleagues too. So that's just an introduction. The Gentle Max Pro has 2 wavelengths, the 755 and the 1064. But it's not just that, it has many different pulse durations, including the sub-millisecond, microsecond mode, and different spot sizes for 1064, including the 1.5 millimeter, which can be used safely for facial telangiectasias, as well as the 3 by 10 millimeter elliptical spot size. So what I would like to discuss, I would like to talk briefly about hair removal and where the 1064 long pulse NDYAG fits in. Vascular users, there are plenty of vascular users, but also for those of you who probably don't know, you can use the NDYAG in acne for rejuvenation, dilated pores. You can use that for scars, whether they are flat or hypertrophic, certainly for warts and verrucas. And as I said, my colleague from Mexico will going to be sharing his experience in onychomycosis. So why are we starting with hair removal? Because let's be honest and frank about it. Whether you're based in a hospital or whether you're based in private practice, it is still the growth when it comes to the laser market. It's still the #1 laser procedure. So worldwide, the #1 laser procedure is still laser hair removal. It's not laser resurfacing. It's not laser for vessels or rosacea. It is still laser hair removal. This is continuing to grow, and it will continue to grow. So anyone with any sense of business mind, if you are looking into the future and an investment, of course, hair removal remains a core component of that. Now, not necessarily if you're a doctor that you should be personally doing these treatments. And some countries, like here in the United Kingdom, for example, we tend to delegate these treatments. But nevertheless, it is important that we talk about laser hair removal because it's going to stay and it's going to grow. It's a growing market. Now, a simplistic way of looking at the division in terms of, okay, which wavelength in terms of laser hair removal will suit which skin type. This is a simplistic way, which most of us will agree with, that if you have a lighter skin type, well, you'll be using the 755 because it works very well. And if you're a darker skin type, to reduce complications, we'll use the NDYAG. But remember, we live in the real world, and the real world is globalization. The world is turning brown. There is immigration. If you think, for example, that here in London, we're dealing with skin types 1 and 2, that's actually a fraction of my population. The vast majority of my patients are all the way from skin type 4 and 6. So it is very diverse, and in many countries, there is movement. But also people are traveling, and people are tanning, and we are getting summers. So even if you are a skin type 2 with a tan, now you will see that you can get some problems with the 755. So why is it important to incorporate 1064? Because it will going to give you some added advantages, as you will see. And if we look at the literature and if we look at the evidence in terms of hair removal, we know that these wavelengths work. We know that the 755 and the 1064 and the IPLs, they do work. But what is consistent from all the evidence is that the 1064 is the most suitable and the best one in the darker skin types because it has the highest level of safety. So I know that there are other wavelengths in between that claim to work very well for the higher skin types. but nowhere near as good as the 1064. But let's remember one thing. We are not just talking about 1064 for hair removal and darker skin types. We are also talking about 1064 in other uses as well. So it makes just a better business proposal to go for the 1064 rather than, for example, just a diode with limited applications. Now, I hope you can see the clinical images, but what you see is something that we used to encounter every time as we approach the end of spring and the summer months. We have these women who will go on holiday. Their skin types, 2 or 3. Normally, we would treat them with the long pulse alexandrite. We're fine. They get a tan, and boom, you get these complications. And that's because tanned skin absorbs the 755 very avidly, very strongly, and we start to get these complications. So the 1064 is very safe and can be used in these scenarios. And this has changed our practice because now, and this is another example. So women will go on holiday, they will wear skirts, they will get a little bit of tanning. We treat them with the 755. They used to be treated well, and boom, they get these complications. So what will be safer is to use the 1064. And I have published on this in terms of complications of lasers, that even the lighter skin types, when they have increased tanning, they can be susceptible to laser burns and complications using the 755 because it's very strongly absorbed by melanin. So how did this change our practice? By simply having the 1064 NDYAG, we can now treat all year round without the summer break, and we can also treat tanned patients. Now, do not underestimate the importance of this, because so I'm based in EMEA in Europe, and I obviously do workshops in many European countries. And what happens, unfortunately, in some southern European Mediterranean countries is that many of them say, well, during the summer months, we simply don't treat. The clinic is closed, or they don't offer any laser hair removal because everyone is tanned, and everyone, if they're using the 755 alexandrites, most people will get reactions. So they will either undertreat and use very low fluencies and get unhappy customers, or simply do not treat. Now, what most colleagues don't understand or don't appreciate is that you can actually treat tan skin patients using the 1064 NDYAG. So we do a test patch. We see them after 48 hours. But with the NDYAG, the behavior of the skin is very different from the 755. So now we treat all year round. And because this is the question that is often asked to me, do you treat in the summer? Yes, we do treat. Why do we treat in the summer? Even the skin type 2 and 3? We treat them in the summer because we have the NDYAG. So even an English lady who's a skin type 2, when she comes back from the Canary Islands and she's having a tan, now, if you think you're just going to wait 4 to 6 weeks for that tan to just fade and then treat it again with a 755, that is a very naive approach. And I can tell you that we have had laser burns even 2 to 3 months after they've had a tan. And that is because some people can just hold on to the tan for a bit longer. So in that case, what's very easy is we test patch them with the 1064, and we continue treatment with the 1064. And as we approach the end of the summer months, or the tan fades, we then move over to the 755. Because we have one platform that has both wavelengths, we can continue to treat the patient. And it's absolutely fine, for the same patient to be treated on the 755, but because they have a tan and it's in the summer months, you switch them over to the 1064, and then after a few sessions, you go back to the 755. That is not a problem. It's just a different protocol. And we just need to guide the staff. But this is a key advantage, is that we can treat during the summer months, we can treat darker skin types, but more importantly, we can also treat the tanned, lighter skin types who could potentially have a problem with the 755. But that's not the whole story, okay? There is also growing interest in the use of laser hair removal devices for medical conditions. And this is a very nice article in the Journal of Cutaneous and Aesthetic Surgery that was published recently about the unconventional uses of laser hair removal. So that is using a laser for hair removal, but not with the intention of hair removal, but with the intention of an improvement in a medical condition. And these are some of the conditions where there is clear published literature and evidence regarding its use: pilonidal sinus, hidradenitis suppurativa, pseudofolliculitis barbae, particularly common in these skin type 6 patients. And these pseudofolliculitis barbae, where they have these ingrown hairs, especially in the beard area, sometimes it can even give them keloid scars. Treating them with the long pulse NDYAG can give a huge relief and improvement also in their quality of life. So if we look at pilonidal sinus, and this is something now where the general surgeons, the colorectal surgeons and the general surgeons are very well aware of this. And I get personally many referrals from the general surgeons. They will do a pilonidal sinus surgery. They will refer the patient to me for laser hair removal to decrease the recurrence rate. Those of you who are familiar with pilonidal sinus understand that it has a high recurrence rate post-surgery. But when you post-surgery treat them with the long pulse NDYAG, you reduce the risk of recurrence. So particularly if you are in a setting or in a hospital where there are surgeons working, you could collaborate with them. And this is one article that looked particularly at the evidence, and the evidence is there with the 1064 stronger than the long pulse alexandrite. And the same applies to hidradenitis suppurativa, a horrible disease where we get these boils in the armpits and in the groin. And yes, we do have tablets, and we even have biological injections. But these tablets, as well as the biological injections, can safely be combined with laser hair removal. So the intention here is not to use just the laser to reduce the hair growth, but when we use the laser hair removal, we also improve on the condition of hidradenitis suppurativa, because both pilonidal sinus and hidradenitis suppurativa relates to the hair follicle. That's where the main problem is. It arises from the hair follicle, and therefore treating the hair follicle with a long pulse NDYAG helps too. And again, just like with pilonidal sinus, for hidradenitis suppurativa, most of the evidence was with the long pulse NDYAG. So we understand that for some of these conditions affecting the follicular unit, pseudofolliculitis barbae, hidradenitis suppurativa, pilonidal sinus, the long pulse NDYAG seems to be better than the alexandrite. So if we just wrap it up in terms of laser hair removal and the NDYAG, what are the advantages of NDYAG? First of all, you can treat all skin types. There is no way, and there is no clinic in London that does hair removal that will just have a 755. You will not have any business, okay? I mean, 60% of the Londoners are from ethnic minorities, higher skin types and different skin types. And then you have all these interracial marriages. And even if someone is a skin type 3, they sometimes behave differently and behave almost like a skin type 4 when it comes to laser hair removal. So you're going to have a wavelength that will potentially be able to treat all the higher skin types and the darker skin types. You can also treat all year round. So there is no discussion of, do you treat in the summer? Do you not treat in the summer? What do you do? Fine. As summer approaches, we move them over to the NDYAG. We have a protocol in place. And then once summer is over, then we revert them back to the 755. This is for the lighter skin types. We can treat tan skin, so there is no problem with that. And this is important because many women are so careful about their schedule. They do not want to have longer gaps. They want to have the every 6 weeks or the every 8 weeks treatment. And if we can offer that to them, even if they have tan skin, using the NDYAG, that will be an added advantage. And also remember, there is better evidence for medical conditions associated with hair removal. Okay, so that's for laser hair removal. But now I would like to spend some time talking about some of the other things that we could do with the long pulse NDYAG beyond just hair removal in the darker skin types and in the tanned patients. And why is that? And that is because the 1064 is the only wavelength that is absorbed by all 3 main chromophores in the skin. So we use it in hair removal for targeting the melanin, but it is also absorbed by hemoglobin, and it's also absorbed by water, which is the main component of the dermis. So by using each of these chromophores, the 1064 can actually give us clinical results in different conditions. So let's look at some of the applications. Vascular, plenty. So anything venous, anything blue is going to be treated with the NDYAG. That is not just because it's deep, but venous blood is rich in deoxyhemoglobin, which absorbs very avidly the 1064. hypertrophic port wine stains, deep vessels in the legs. All of them can be treated with the NDYAG. Acne, which is not primarily a vascular condition, very nicely treated with the NDYAG. Warts, verrucae, diffuse redness or rosacea, tightening, rejuvenation, dilated pores, flat or hypertrophic scars, onychomycosis, and some other conditions too. But I just, given the time, would like to introduce you to some of the key things that we tend to do and we see a lot of. So if we are talking about using the long pulse NDYAG in vascular uses, the spot size matters, because if I'm treating facial vessels or leg vessels, then I would like to have either the small spot size, the 1.5 millimeter, which you can have on the GentleMax Pro, or the 3 by 10 millimeter elliptical spot size. If I'm treating venous malformations or lakes, then I'm going to use a slightly larger spot size. For diffuse redness, rosacea, I can use a larger spot size. So different spot sizes matters. So I get lots of requests for periorbital veins. You just numb the eye with some eye drops, put corneal protective shields, long pulse NDYAG, small spots, 30 milliseconds, beautiful. And this, you can see the clearance. This is pretty much a few minutes afterwards. Very nice results, very satisfying. Another example, periorbital vein. This is not something that you can treat with the alexandrite. This is not something that you can treat with a pulse dye laser. Okay, beautifully treated with the 1064 NDYAG. Another example, even sometimes women will pull down and say, I hate that vein there. That's fine. You can easily treat that with the long pulse NDYAG. Another example, no scarring. Dilated vessels, telangiectasias, all of them can be treated with the long pulse NDYAG. Same here. So again, this is an example where I say if you have the 1.5 millimeter spots, okay, which you have on the GentleMax Pro, you choose a 1.5 millimeter spot with the right pulse duration and the fluence, you can trace literally these individual vessels. Now, the chance and the risk of getting complications, such as atrophic scars with a 1.5 millimeter spot, is very, very low. If you're using a large spot size, yes, you can then get problems. But this is the advantage of having the very small, fine 1.5 millimeter spot that you can trace individual vessels. These vessels are deep, beautifully treated with the long pulse NDYAG. And then you can finish off with a larger spot size, the entire area. Venous lake, here, one single session, one single treatment with the long pulse NDYAG, choosing the correct spot size, choosing the correct pulse duration, you get that shrinkage, you get that cavitation color change, and in 3 weeks' time, it will disappear with no scarring. Other examples. Another example, you can see just even a small one, and you will be surprised. There are some women who will literally come and say, I just don't like this spot, and then you can just assure them that you can easily treat this. Another one. This is another venous lake that you can easily, clearly treat with a long pulse NDYAG. Now, let me tell you one thing. Once you know what you can treat with the NDYAG and you get the skill and the confidence, you will suddenly see in the practice things that you before did not used to see. So suddenly you will see the venous lakes, suddenly you will see the periorbital veins, suddenly you will see the leg vessels, because before, if you didn't have the NDYAG or didn't have the skill to use them, you will just overlook them or not even try and engage with the patients about it. But once you get that skill, suddenly you will see that you're coming across all these conditions to treat. Spider angioma, you can easily treat with a long pulse NDYAG too. Leg vessels, leg telangiectasias, in a combination with sclerotherapy, but using different spot sizes, different pulse durations. So for the very fine vessels, you'll use a 10 millisecond or a 20 millisecond. For the very larger reticular veins, you'll use a longer pulse duration. So and this is why I say it's important that you have a system with a long pulse NDYAG that gives you different pulse durations, because sometimes on one leg, I'll be changing the pulse duration 5 or 6 times, depending on the size of the vessel, the diameter of the vessel. So generally speaking, if it's red, it's around 20 millisecond. Once it becomes a little bit blue-purple, I use the 30 millisecond. If it's green, it's 40 milliseconds to 60 milliseconds. The feeding vessel, 50 to 60 milliseconds. And this is roughly the range of fluents that you will need to coagulate these vessels. And why is it that you will need a higher fluence when we're using when we're treating the finer, smaller vessels? And that is because of physics. We all learn from physics, this is Bernoulli theory, that when you have a narrowing, you get a higher velocity, so the speed increases. So when you basically, if you go from a blue vessel, a blue vein, into a small red vessel, because the diameter is narrow, the flow of blood is much higher, is much faster. And with a faster flow means you lose the heat quicker. So you will need to generate a lot of heat very quickly. So the pulse duration needs to be short. Otherwise, if it's too long, you just have lost all that heat. And you need a high fluence because there is a low chromophore, because it's a red blood vessel, it's a small blood vessel with low chromophore. So you need a high fluence in a very short pulse duration to accumulate enough heat to get the coagulation and the destruction of the vessel wall. So this is why, because I get asked this question a lot, why do we use a much higher fluence for the smaller, finer vessels? And that is simply because the heat is washed away much faster compared to a blue or a green vein. And, you know, there's a lot of evidence that the 1064 is the best wavelength for leg vessels. This is one article looking at the difference between the 532 and the 1064. And even sometimes if you think the vessel looks very superficial, it's very red, I can treat easily with the pulse dye laser, that may be true in some cases, but in reality, when it comes to the depth, the 1064 gives us a much deeper, more uniform heating of the vessel, and therefore it is the preferred choice of wavelength for leg vessels. Now, this is where I get very excited. And, you know, sometimes there are certain companies that promote their NDYAG as one of their new NDYAG that does a lot of things. But if you look carefully, as we say in English, you know, the proof is in the pudding, you'll notice that it's an NDYAG with a microsecond domain. So it's simply going below 1 millisecond. So when you use an NDYAG below 1 millisecond, okay, let's say 300 microsecond or 500 microsecond, then we talk about the microsecond domain. So the pulse duration is very, very short. It's too short to overheat the epidermis, okay? Therefore, no cooling is required, but it is very much absorbed by water. Remember, the NDYAG is absorbed by melanin, hemoglobin, and water. So when we use a microsecond pulse duration of the NDYAG, it's too short to overheat the melanin, the epidermis, so we don't require cooling for that. But it is absorbed by tissue water, which is in the dermis. So in essence, what we're doing when we're using microsecond NDYAG is we are heating the dermis. We are generating heat. It's bulk heating. So any condition that requires heating of the dermis, you can use the microsecond NDYAG. And this is why we use it in acne, because we want the heat to stimulate the heat shock proteins, to get this bacterial killing, to get the sebocytes to regress. We want this heat of 60 to 65 degrees in the dermis to get that tightening effect, the rejuvenation effect. Heat matters in scars too. So the microsecond NDYAG has many, many applications. And I just want to show you, you know, very simplistically, that you can see this is how when you have a Gentle Max Pro, and when you have it on the YAG, you'll see green, you'll see that's the Gentle YAG. Just look there where I have just put an arrow, that's microsecond pulse. So it's very, very easy. When you go on the Gentle YAG, you choose the spot size, you then just dial in below 1 millisecond, and you can go as low as 0.25. So this is 250 microseconds. You can go 500 microseconds. So I always say that the Gentle Max Pro is not just two wavelengths. It's not just the 755 on the NDYAG. I say it's a 3-in-1. It's the 755. It's the long pulse NDYAG, which we'll use for hair removal, vascular, many conditions, but it's also the microsecond NDYAG. And it's astonishing how many colleagues actually didn't realize that they can go into the microsecond mode with the Gentle Max Pro NDYAG. So it's there for you, I can show you. So what are some of the conditions, again, that we can treat with the NDYAG? Well, we can certainly treat diffuse redness, rosacea, and there are different protocols. And by the way, everything that I'm saying here in this presentation is backed up by evidence, backed up by literature. So none of this is personal opinion. All of this can be found in publications listed on Medline or PubMed. So it's actually very straightforward. You just need to spend some time going through all this literature, and even the settings are there. So everything is being published, and I'm just adding my experience to it. So for diffuse redness or rosacea, you can use the microsecond mode. So that's going sub-milliseconds, larger spot size, multiple passes, high frequency, or you can use a pulsed mode with cooling. If you want, for example, to choose the pulsed mode with cooling, there's even a publication in a very respected journal, the Journal of American Academy of Dermatology. This is using the gentle YAG. You can see the parameters that were used: 10 millimeter spot, 40 joule, 50 millisecond. I usually make it very simple and tell people it's 10, 50, 50. 10 millimeter spot, 50 millisecond, 50 joule. And then, of course, depending on the degree of inflammatory spot, the size of the individual spots, I will adjust the pulse duration or the fluence. But there is evidence using the gentle YAG, the 1064 from the gentle series in papulopustular rosacea. Now, another very nice study by Murad Alam from Chicago in the US. Here is a comparison between one of my favorite, which is the pulse dye laser on one side, versus microsecond NDYAG. So that is high frequency, below 1 millisecond, multiple passes, heating, just like a Genesis. Okay, by the way, whatever the laser Genesis can do, we can exactly do the same with the gentle Max Pro, exactly the same, if not even more, because we have more control and choice of the microsecond pulse duration that we have. Both of them worked. But in darker skin type, the microsecond NDYAG was safer. So you know when you have a skin type 4 or a skin type 5 with diffuse redness, and you're worried using an IPL, you may be worried using the pulse dye laser, or had a pulse dye laser and developed some post-inflammatory hyperpigmentation. Fantastic with the long pulse NDYAG. You just put it on the microsecond mode, do the painting technique. They need few treatments, but you can get very nice results. So microsecond NDYAG, microsecond NDYAG, microsecond NDYAG, single session, microsecond NDYAG, single session, microsecond NDYAG. Acne, again, just like with rosacea, you can use it either in the long pulse mode with cooling or with the microsecond. I don't want to get you confused. Once again, if you're using it in the microsecond mode, because of the very short pulse duration that is not overheating the epidermis, you don't need cooling. But whenever you're using the NDYAG in a long pulse mode, you are going to overheat the epidermis, therefore you need cooling. So very simple. If it's in a long pulse mode, you need cooling. If it's in a microsecond mode, you don't need cooling. And I have published many years ago on the use of lasers in acne, including the NDYAG. So this is nothing new. NDYAG for acne. NDYAG. NDYAG. She's actually a Brazilian patient. And, this is important. If you think that you can put easily all patients on Accutane and give them antibiotics, well, good luck. Generation Z, they are very, very focused on the microbiome and the bowels. And I actually gave a presentation to Latin America about the microbiome and acne and the skin. We're facing with patients who simply want less systemic intervention and want, in addition to some of the topical treatments and the skincare treatments that they use, they want energy-based devices. And I can tell you one thing, if you don't do it, someone else is going to do it. This is what I learned. So, if I don't do it, I know that they're going to go somewhere else, and they're probably going to go somewhere who just has a cheap IPL, and we're just going to treat them. So I might better treat them because I know what I'm doing, and I can give them good results. Rejuvenation, again, it's all about dermal heating. If you can get that heat into the dermis, using the water as the chromophore, you get that inflammatory response, you get that stimulation of the collagen, the tightening, you're going to get good results. So how do we do it? Again, it's the microsecond mode, so a large spot size microsecond mode, multiple passes, and you generate that heat, and that can give you that nice tightening. You can use that for dilated pores, for example, or just in combination with HIFU. So this is a new thing. And I learned this also from my colleagues in Korea. So you use the HIFU, high intensity focused ultrasound, to get the heat deep into the SMAS layer. So you get that contraction, and then you finish it off with microsecond NDYAG on top. Okay, so it's a dual approach, and this is what we're starting to do. So HIFU first, followed by microsecond NDYAG, because what the HIFU will do is give you that tightening and lifting, but it doesn't necessarily always give you that improvement in the texture and the appearance of the skin. But that is what the microsecond NDYAG can add to the HIFU. So some examples, this is just all with the microsecond NDYAG. It will require a few sessions, but you can combine this, as I said, with high intensity focused ultrasound. And this technique, once again, everything that I'm saying is backed up by literature. There is evidence using the gentle YAG. So using the 1064 NDYAG from the gentle series. This is in Korea with higher skin types. So once again, they use the 8mm spot, 0.3 milliseconds. So that's microseconds. So that's 300 microseconds. In a painting mode, remember, if it's a microsecond, you don't need cooling. And that led to improvement in collagen. And the nice thing about the study is that they took biopsies as well after treatment, and they could see an improvement in the collagen. So it's also very safe to use in darker skin type because you're using a microsecond mode. So if you have a thermometer, basically what the idea is that when you're using the microsecond mode with multiple passes on the face, you're generating that heat. If you then use an external thermometer, a temperature of around 40, 42 degrees on the surface translates to a higher temperature deep in the dermis. And we know that the magical number is 60, 65 degrees, depending on what you want to do. If you want tightening and rejuvenation, you really want to get to 65 degrees, okay? Whereas if it's just diffuse redness and acne, you don't necessarily need to get that. To 60 or 55 degrees sometimes kickstarts the inflammatory response to give you that improvement. So for acne and diffuse redness, slightly less temperature on the surface, but for tightening and rejuvenation, higher temperature. Warts and verrucas actually can very nicely be treated with the NDYAG. I mean, it's just that there is a lot of evidence for the pulse dye laser, but equally there is lots of evidence for the NDYAG. This is just one article from Korea. Again, darker skin types, 369 cases, long pulse NDYAG in verruca. And I know my colleague and my friend in Mexico, Dr. Ricardo Galvan, he talks a lot about the long pulse NDYAG in verrucas as well, including at the ASLMS. He gave a talk 3 years ago. So you can use a small or a slightly larger spot size, depending on how thick and how large the verruca is. It's usually 20 to 25 millisecond as a pulse duration, but very nice results. So again, this is one example, very difficult verruca with cryotherapy or salicylic acid. See the blackening, the darkening after the NDYAG, and nice clearance, no scarring. Another example, just I have a few more minutes, I'm nearly there. Scars, again, we're treating not just the vascular component, but we're treating the collagen component. Once again, this is where it gets confusing. Now, the best evidence, if you look at the literature and the evidence, the best evidence for using the NDYAG in scars is with the microsecond mode, So going below 1 millisecond. And there are two types. There is the contact mode with cooling, so that is using the high fluence. So for example, if you're using a 5 or a 6 millimeter spot around 60 joules, you're below the purpuric dose. So there is something called the MPD, the minimum purpuric dose for an NDYAG. So you can get purpura with an NDYAG, but that really is generally quite a high fluence. Sometimes you're likely to get some problems. But if you just go below that, so if you're using a 5 millimeter spot, something like a 60 joule is often below the purpuric dose, but it generates enough heat to have an effect on the vasculature and the collagen. And I will show you some of the reports that you can then go back and read about how the NDYAG affects the collagen fibers and scars. But it's always the sub-millisecond that has the best evidence. So if you're using it for hypertrophic or thick scars, you're using the high fluence with cooling, but still microsecond mode. But if it's just flat scars and you just want to improve on the erythema, then you do just the painting technique with no cooling. And that, again, can help. So, for example, this is one article published in Lasers and Surgery in Medicine almost a decade ago using the sub-millisecond, so microsecond NDYAG in dark skin type patients. Those of you who are familiar with keloids will know that the senior author here, Rei Ogawa from Japan, award-renowned professor in scars. And this article, you can get that free. It's online on PRS Open on the use of NDYAG in hypertrophic and keloid scars. So you can see here, when it's hypertrophic or keloid scars, you will use a high fluence with cooling in a contact mode, but it's still a short pulse duration in a microsecond mode. So just remember, NDYAG in scars, preferably with a microsecond mode. If it's flat, it's painting technique, and if it's thick, it's going to be the pulse mode with cooling. And even I published on this. This is my article in Lasers and Medical Sciences. This is 4 years ago on the whole evidence regarding the use of NDYAG, regarding the use of lasers in keloids and hypertrophic scars, including the NDYAG. Something that I recently did with our colleagues in Vietnam, a collaboration, is the combination of picotoning with microsecond NDYAG for some of the difficult melasmas. So those melasmas that are still not responding to the topical treatment and the picotoning, when you add in the microsecond NDYAG, you're targeting the dermis. Remember, we know that melasma has a problem with solar elastosis, with increased mast cells, with increased vascularity. We know this. This is why we give oral tranexamic acid. So therefore, you will see that there are many, many reports using the microsecond NDYAG in melasma. And that is because it's basically dermal rehabilitation. You're rehabilitating the dermis. You're improving on the solar elastosis through the microsecond NDYAG. You're improving on the quality of the dermis. You're also decreasing the vascularity. And if you combine that with the picotoning, you're getting good results. So we published this already. So some examples. Okay, so finally, look, I'm not a businessman. I am not really. And those of you who know me well will know that, you know, I just love to treat patients. And in fact, many patients I treat are pro bono, really. I just love my job and I'm very passionate about it. But throughout the years, I have also learned that talking to managers is very different from talking to colleagues. I can talk to you as doctors and you just understand where the NDYAG sits and how important certain wavelength is for certain medical conditions. But I can assure you, with all due respect, if I'm going to go to my manager and say this, you know, chances are I'll get nothing. I will not get the NDYAG because they don't necessarily, you know, understand our language. We have the advantage of seeing patients and knowing what's best for them. But really, managers look at it from a different way. So trying to convince a manager is going to be difficult. So over the years, I've learned to basically speak their language. Okay. So if you want, for example, to get an NDYAG in your clinic, you're not going to say, well, I need an NDYAG. You're going to have to say, well, look, I'll come up with a business plan. And this is what I did to get into one of the clinics, because I work across a number of clinics, but in one of the clinics, we wanted the NDYAG, and this is how I went about it. I basically just looked at what I was doing over the last 6 months, okay? So hard facts, pull data, what have I been seeing? And it's obvious, as a dermatologist, I'm seeing rosacea, I'm seeing acne, I'm seeing warts, I'm seeing dilated pores, I'm seeing rejuvenation, I'm seeing leg vessels, I'm seeing telangiectasias, of course. Okay, so I just made a very simple business proposal and said, look, if I just treat one acne patient, one rosacea patient, and one wart or rejuvenation or a leg vessel, and then just a hair removal a week. And, you know, we'll put it just at a relatively low cost for us, which is $300. So that's 4 cases a week at $300. That's $1,200 a week. So a month, that's almost $5,000. A year, that's almost $60,000. And that's just from one doctor. And then I convinced the manager to basically run some targeted marketing, Google ads. So for example, if you have an NDYAG and you know that you can treat verrucas and you know that you can treat diffuse redness and acne, you can then just have a limited budget and do the right marketing through Google, get all these patients, and it will gonna grow. And that's how I managed to convince my managers. So, you know, talking to the managers is not talking about the evidence and here is the article. That's not going to work. But you give them a business proposal. You tell them, these are the things that I can treat with the NDYAG, and this is what we can charge, and this is how I can get the return of investment. And it works. So finally, this is a very important slide, okay? I'm coming toward the end, and I've used my 45 minutes, and I'm very grateful for all of you staying in and listening to me. Maximize the benefits of the NDYAG. The NDYAG is not just a hair removal for skin types 5 and 6. No, it's a hair removal for skin types 5 and 6. It's a safe hair removal in tanned skin, even if they're skin type 2 and 3. It's safe to use in the summer, and it also has benefits for those medical reasons, such as pilonidal sinus or hidradenitis suppurativa. The NDYAG can actually do about 70 to 80% of what the pulse dye laser can do if you know how to use it, okay? So it is a fantastic wavelength that's often unloved and misunderstood, and a lot of vascular conditions can nicely be treated with the NDYAG. It also has some non-vascular uses like acne, warts, scars, melasma, and remember the popularity and importance of microsecond NDYAG. So with that, I would like to thank you all. This is my email. These are my details. If you want to ask me any questions, I'll be more than happy to answer. And I'll hand over to my colleague from Dr. Zaldivar from Mexico, who will going to be talking about onychomycosis.
Hola, ¿qué tal? Buenos días. ¿Cómo están? Soy el doctor Federico Zaldívar. Estoy en Monterrey, México. Ahorita les voy a compartir mi experiencia con algunos casos de onychomicosis y bueno, vamos a comenzar la presentación. Perfecto. Bueno, les voy a presentar la técnica que utilizamos aquí en la clínica. Les voy a presentar también algunos casos clínicos, algunas generalidades. Y bueno, pues vamos a comenzar con algunas generalidades. Digo, no, el objetivo de la charla no es darles una clase de onychomicosis, sino más bien cómo lo trabajamos con el láser. Bueno, pues ya sabemos que el 70% de los casos son causados principalmente por dermatofitos, principalmente el Trichophyton rubrum. Sabemos que nos afecta aproximadamente del 2 al 13% de la población occidental, y que esta va aumentando con la edad, con el tabaquismo, la diabetes, trauma unguial, inclusive con la inmunodepresión. Y bueno, como ya sabemos y está publicado, el tratamiento oral pues sigue siendo el gold estándar, pero pues bueno, tenemos esta opción de tratamiento con láser para pacientes que no son candidatos al tratamiento vía oral o que no desean tomar algún tipo de medicamento. De los tipos de onychomicosis, bueno, pues tenemos la subunguial distal lateral, que es la más común. Tenemos subunguial proximal, la superficial, candidiásica y la fase final de la onychomicosis, que vendría siendo la onychomicosis distrófica total. Les voy a presentar ahorita algunos casos o algunos ejemplos de cada uno. Pues bueno, tenemos que la subunguial distal lateral es la más común de los 5 tipos, como comentábamos ahorita. Y esto pues comienza en el hiponiquio, en la zona distal, y esto produce hiperkeratosis del lecho, se va engrosando la placa, decoloración y termina principalmente con onycholisis. En la subunguial proximal, bueno, pues esta la tenemos que es la menos frecuente en pacientes sanos. Se ve principalmente en pacientes con alguna alteración de la inmunidad y se reportan una incidencia en 87% en pacientes con VIH. El agente más común en este tipo de casos es el Trichophyton rubrum. Y bueno, pues aparece con la misma frecuencia en manos y pies, va invadiendo el pliegue unguial proximal y ya posteriormente penetra la placa unguial y afecta toda la uña. En el caso de las onychomicosis superficiales, tenemos que el patógeno más frecuente viene siendo el Trichophyton mentagrophytes. Esta va invadiendo la placa, el lecho unguial, el hiponiquio, y se ve principalmente blanquecina la uña quebradiza y afecta principalmente pues toda la uña. En cuanto a las onicomicosis candidiásicas, bueno, tenemos que estas se dividen principalmente en 3 categorías. En una onicomicosis proximal que se asocia a paroniquia crónica, en una onicomicosis distal secundaria a candidiasis mucocutáneas crónicas y bueno, una onicolisis candidiásica. Y la fase final, que es como nos llegan aquí nosotros en la clínica, la mayoría de los casos, pues ya es la distrófica total, donde pues prácticamente la uña ya está totalmente destruida. Tenemos afección de toda la matriz unguial y pues aparecen masas queratóxicas friables. Esto puede ser causado por dermatofitos, mohos, inclusive cándida. El concepto del tratamiento de las onicomicosis con láser se comenzó desde los años 80. Alfelberg realizó publicaciones donde se probó con NDYAG de pulso largo, NDYAG de pulso corto, láser CO2. Y la diferente literatura reporta resultados mixtos, algunos tan bajos como del 27% de curación, y algunas otras publicaciones reportan resultados altos de un 80% de curación. El concepto del cual se tiene, por qué funciona el láser, es principalmente por el proceso, por la fototermólisis, que esto se debe a que la absorción de la luz del láser por el hongo se convierte en energía y en calor, y se tiene el concepto de que los hongos son sensibles a temperaturas mayores a 55 grados. Esa es la teoría de cuál es el principio de fungicida del láser al momento de nosotros realizar el tratamiento. Y pues bueno, ¿cuáles van a ser las ventajas del tratamiento de onicomicosis con láser? Principalmente, pues bueno, sin la necesidad de dar un tratamiento vía oral o en casos muy avanzados que no responden, disminuir el tiempo del tratamiento de vía oral en vez de que sea un tratamiento de 6, 12 meses. Ahorita les voy a presentar algunos casos donde nosotros en 3, 4 meses prácticamente limpiamos la uña en su mayoría. Es un tratamiento rápido. Nosotros aquí en la clínica las sesiones tardan aproximadamente 10, 15 minutos. Ok, no hay incapacidad, no hay recuperación, los pacientes salen caminando, la uña no se les cae, la uña no se les quema. Y pues bueno, otra ventaja pues es que con el láser no tenemos consumibles, así que básicamente pues no nos cuesta. Las desventajas, pues bueno, es principalmente el dolor o la sensación de calor, que ahorita vamos a platicar un poquito acerca de eso, que siente el paciente, y pues el costo principalmente pues de adquirir el equipo. ¿Cómo preparamos al paciente nosotros aquí en la clínica? Bueno, pues primero que nada el paciente debe de acudir sin esmalte o pintura en las uñas, ¿ok? En pacientes que usan talco, es muy importante que acudan con sus pies limpios, que no tengan talco, limpiamos inclusive la uña también, que no haya fibras ahí, residuos ahí del calcetín, si traen algún calcetín de algodón o algo. En personas que usan artículos de joyería, pues hay que retirarlos. En caso de que haya vello, hay que retirar el vello porque, pues como ya sabemos, el láser NDYAG también tiene afinidad para la melanina y no queremos hacer una depilación, lo que queremos es pues principalmente tratar la uña. No se recomienda ningún tipo de anestesia tópica ni ningún tipo de bloqueo porque es importante que el paciente nos esté dando retroalimentación sobre la sensación de calor precisamente para evitar complicaciones. Nosotros aquí en la clínica no hemos tenido hasta la fecha, en 4 años que tenemos realizando el tratamiento, no hemos tenido ni una sola complicación, pero sí es importante esto, que el paciente nos dé una retroalimentación de si le está doliendo de más. Nosotros aquí tomamos fotografías clínicas antes de comenzar cualquier tratamiento y pues bueno, la historia clínica del paciente y su protección ocular. Esto es importante porque bueno, pues ya sabemos que el láser NDYAG es del espectro de luz infrarroja y aunque no se ve un flash como tal, es un láser que sí nos lastima la vista, entonces tanto el médico como el paciente deben de traer su protección ocular. Y la técnica que utilizamos es una técnica sencilla, utilizamos un patrón de criss-cross, básicamente vamos agarramos un patrón horizontal, posteriormente vamos moviéndonos en movimiento vertical y vamos superponiendo los pulsos. Esto a mí lo que se me quedó muy grabado fue como los anillos del Audi, haz de cuenta que vamos superponiendo los pulsos, así como se muestra aquí en la imagen de abajo. Y los parámetros utilizamos nosotros en el Gentle Max Pro un spot de 5 milímetros. que bueno, el distanciador que viene en el equipo que tenemos nosotros viene siendo el de 6-8 milímetros, pero el spot que se selecciona es el spot de 5. Para fototipos del 1 al 4 utilizamos una fluencia de 14 a 18 joules. Nosotros lo manejamos aquí estándar con 14 joules, ¿ok? Y para fototipos 5-6 se bajan los parámetros de 12 a 16. Nosotros el 90% de nuestra experiencia viene siendo con pacientes de fototipos de 2 a 4. La duración de pulso, bueno, ya platicamos de eso, es de 0.3 milisegundos. Utilizamos una frecuencia de 2 a 5 Hz y se manejan generalmente de 5 a 9 sesiones. Nosotros aquí en la clínica las realizamos de una vez por mes. En el caso del área, por ejemplo, en los pies se recomienda un mínimo total de 1000 disparos por pie. En el dedo pulgar les damos 600 disparos, pero estos 600 disparos no los damos continuos porque la sensación de calor sí es importante. Nosotros lo que hemos aquí encontrado es de que los pacientes generalmente toleran 50 disparos. 50 disparos y nos cambiamos de uña. En el caso de los dedos, ya del resto de los dedos, damos 100 disparos por dedo, que los pacientes toleran aproximadamente en el resto de los dedos 25 disparos y cambiamos. En el caso de las manos, se dan menos disparos. En el caso del dedo gordo, damos 400 disparos y en el resto de los dedos damos 200 disparos, como les comentaba, más o menos en unos lapsos de 25 disparos. Aquí les voy a presentar algunos casos clínicos. En todos estos casos utilizamos los parámetros que ya les mencionaba. Utilizamos una fluencia de 14 joules con 3.3 milisegundos con el spot de 5 milímetros. Y pues bueno, aquí tenemos un paciente masculino de 40 años de edad. Tiene 20 años de evolución con el problema. Ya ha tomado tratamientos previos vía oral. No tiene comorbilidades adicionales. Y este caso que están viendo ahorita, esta imagen, es el paciente que sigue ahorita en un video que les voy a presentar. Ese es el procedimiento como lo realizamos. Ahí vemos la potencia de 14 joules con 0.3 milisegundos. Este paciente ya lleva 5 sesiones previas. Ya si ven las uñas se ven muy diferentes a como se ven en la foto. Y básicamente ahí ya estamos trabajando ya los 50 disparos. Trabajamos solamente sobre el área de la uña que se encuentra afectada. Ya donde no tenemos presencia de hongo, ya no es necesario realizar el tratamiento. Y pues podemos ir viendo cómo lo vamos realizando. Ahí cuando el paciente movió los dedos fue cuando el paciente me refirió precisamente pues que ya le estaba molestando. Ya nos estábamos acercando ya a los 50 disparos. Les voy a presentar ahorita otro caso clínico. Esta es una paciente mujer de 26 años de edad que tiene 4 años de evolución con el problema. Ella acudió a la consulta ya con un KOH positivo. No tiene comorbilidades adicionales. Podemos ver cómo se encuentran ahí afectadas prácticamente las 5 uñas. Y en este video vemos cómo va evolucionando. Igual utilizamos los mismos parámetros. Los parámetros prácticamente no los modificamos. Ahí estamos dando los 25 disparos. En las uñas pequeñas, pues bueno, es difícil hacer ahí el patrón de criss-cross. Básicamente, pues viene siendo el disparo sobre el dedo.
25 disparos,
Muy bien. Y pues bueno, aquí les voy a presentar aquí algunos casos clínicos. En este caso, pues es el proceso, cómo llevamos. La diferencia entre cada fotografía es un mes. Y pues bueno, podemos ir viendo cómo va prácticamente limpiándose la uña, va saliendo nueva la uña, hasta que pues prácticamente en este caso en 5 meses tuvimos una recuperación completa. Aquí les presento otro caso. Ese es otro de los casos más graves que nos han llegado. Este caso se llevó 9 meses, se llevó un poquito más de lo habitual, pero pues prácticamente el resultado pues fue muy positivo. En este caso también podemos ver cómo prácticamente la uña ya estaba negra. Podemos ver cómo en 6 meses fuimos limpiando la uña poco a poquito y pues tuvimos una curación completa. Aquí les presento algunos otros casos. Caso de las manos. En las manos lo que sí hemos encontrado es que les molesta un poco más, es un poco más doloroso que en el caso de los pies, es un poco más sensible. Aquí les presento otro caso. Y pues esos son los resultados que vamos obteniendo. Ahorita al final les voy a dar las recomendaciones que nosotros les damos a los pacientes aquí de la clínica para su seguimiento. Y las recomendaciones post-tratamiento que les manejamos, además del tratamiento láser, yo les receto una laca de ciclopirox al 8% que se tienen que aplicar por las noches. Un punto muy importante es la higiene. Yo les pido a mis pacientes que se laven y que se cepillen las uñas todos los días por las mañanas con algún cepillo y jabón, el jabón que sea, jabón corporal. Mantener las uñas limpias, cortas. Otra cosa también muy importante es no limarlas, escarbarlas o arrancarlas. Cuando los pacientes llegan con las uñas limadas o que se las arrancan, el tratamiento pues obviamente que es muchísimo más molesto. Otra recomendación muy importante que les damos a los pacientes es principalmente que no utilicen pintura o esmalte durante todo el tratamiento, porque también hemos encontrado de que cuando los pacientes se pintan las uñas, se ponen de esos tipos de esmaltes o geles para pintarlas, generalmente empeora el problema. Les recomendamos también cambiar el calzado cerrado, los calcetines al finalizar el tratamiento, un secado minucioso después de bañarse. Y en personas que usan calzado deportivo o calzado industrial, es importante también que se los cambien después de realizar la actividad, precisamente pues para que los pies no se queden húmedos. Y pues bueno, muchas gracias. Alguna duda que tengan, con toda confianza, aquí están mis contactos, me pueden mandar un correo, me pueden contactar por las redes sociales y pues con todo gusto lo que se les ofrezca. Gracias.
Two great presentations. The photos on the onychomycosis were wonderful. There are clinics here in the United States that buy the gentle YAG only for onychomycosis. So think about the revenue that there is in just that procedure. It is something that is growing. And lastly, I want to thank Tecnoimagen for their support to put this together. I couldn't have done it without them. One last thing that I want to talk about is that I am sending to my team, if you enjoyed this technological talk and you're thinking about it, we can put together a pro forma. Dr. Firas talked about trying to get someone in your practice to purchase it. We can change all of these numbers by amounts and by how many and see whether updating your gentle lays to include a YAG, purchasing a gentle YAG, or purchasing a gentle max, which has both lasers, is something that you might want to do. This isn't anything that's high pressure. I'll be sending this to my distributors, and they will be able to sit down with you and put together a financial presentation so that you can feel comfortable with it. I would like to spend the rest of the time answering the questions, so I'm going to give it back to Daniela, and just real quickly, Daniela is our clinical manager for Latin America. So all of my training, she supports. She trains our trainers at the distributors. She helped me put this together, and she's an overall wonderful person. So again, thank you so much for your time. I'm so happy this went well. We had over 120 people attend. So thank you. And Daniela, please, let's answer the question.
Estamos acá, no solamente yo, sino Fernanda Blanco, también es la trainer de Tecnoimagen, y nos vamos, porque son muchas, nos vamos a ir coordinando. Yo fui tomando nota y las voy leyendo, y tenemos otras que nos fueron enviando por privado. Doctor Firas, empezamos con las del doctor Firas. Doctor, acá hay varias preguntas, doctor, sobre, aprovecharon con otras tecnologías. Pero, por ejemplo, están preguntando si puede compartir los parámetros de rosácea y de tratamiento del lago venoso en las lesiones.
Yeah, okay. Thank you. I mean, really, we wanted this webinar to just be on NDYAG. So For those colleagues who have questions about other technologies, they can just message me personally. I will be happy to help. But for the purpose of this webinar, we want to really give the NDYAG what it deserves. In terms of venous lakes, it depends on how small or how large they are. If you are a beginner, I would suggest you start with 3 millimeter spot because it's a small spot. Okay. Use something around 30 milliseconds. Now, again, it depends on how large, but a starting point would be 3 millimeter spot, 30 milliseconds. Start with 140, 150 joule. And what you really want to see is you want to see the endpoint. You want to see a little contraction, little shrinkage, a little color change. Okay. And then you adjust the fluence according to that. And then remember, you will just see that endpoint. And you will tell the patient it will take 2-3 weeks before it will disappear. So don't see the patient the following day. It will take a few weeks. That's for venous lake. For rosacea, was the question rosacea? Venous lake and rosacea? Yeah, for rosacea, it depends.
Preguntaba sobre los parámetros, pero creo que usted lo explicó.
Yeah, again, it depends on how much chromophore you have, okay? If you are treating papulopustular rosacea with inflammatory spots, okay, what you can do is you can use the 10 millimeter spot with cooling, with DCD, and you can use around 40 joules and 40 milliseconds and do 2 passes. Okay, this is also what's been reported. But with experience, you know that on some of the spots, you might use a higher fluence, like a 50 joule, and in some of the very small spots, you may want to reduce the pulse duration. But a starting point will be 10 millimeter spot, 40 joules, 40 milliseconds. If it's just redness, diffuse erythema, then you can also just use the 10 millimeter spot, okay, but use the microsecond mode, the 0.3, okay, and use something like 8 joules, about 6 to 10 hertz, and then just do few passes until you get heat sensation. If you measure the temperature, you want around 38, 39 degrees. It becomes a little bit more red, a little bit more hot, and few sessions of those. So for diffuse redness, microsecond mode. For papulopustular rosacea, 10 millimeter spot, 40 joule, 40 milliseconds. And I was very happy to see that my colleague, Dr. Zaldivar, for onychomycosis was also using microseconds pulse duration. Really, I mean, the take-home message from this webinar is that the microsecond pulse duration does so much for dermatologists, but it's underused. It's not being utilized. Okay, Danielle, next question, please.
Acá hay una pregunta que me parece que es importante, que justo que estamos hablando tanto de microsegundos, preguntan si microsegundos es sinónimo de Q-switch.
Ah, perfecto.
No. The pulse durations are very different. The microsecond is, much longer than the Q-switch. The Q-switch is nanosecond. So let me get this right. If we start from a very long pulse, we start in a second, then we go shorter into a millisecond, then we go shorter into microsecond, and then shorter into nanosecond, which is Q-switch, and then even shorter is the picosecond. So the microsecond NDYAG is different from the Q-switch because the pulse duration is longer.
En queloides, ¿utiliza solo
Yes.
el neodymium NDYAG o con infiltración de triamcinolona con o sin 5-fluoracilo?
No. You have to combine with injections, of course, because remember, look, the first line treatment remains injections. That is the medical treatment. But some patients don't respond to the injections, and some patients will need a combination treatment. But if you're going to use the laser, for example, the NDYAG, you do combine it, but you do the NDYAG first and then you inject with steroid afterwards. But the article I showed you, the article from Japan, they just used NDYAG. But in practice, I like to combine the two because it works better. So you use the NDYAG and then immediately afterwards you inject. And the reason being is after the NDYAG, you get a little bit of edema, swelling, and that makes the injection a little bit easier. And whether you want to just inject triamcinolone or combine that with 5FU. That depends on what is available. In some clinics, we cannot have 5FU because it's chemotherapy, so we just use triamcinolone. But when I was working in the hospital, we combined that with 5FU. Then I see there's a question about verrucas. Parameters for verrucas. Parameters for verrucas, it depends if it's small or large. If it's small, 3 millimeter spot, 25 millisecond pulse duration, and start with 220, 240 joule. Okay, it can be a little bit painful. If it's a very large one, it's a very thick, deep one, then something like a 6 millimeter spot, again, 20 to 30 milliseconds, and then maybe start from around 160 joules. So high fluence, and it can be painful. Okay.
Sí, acá tengo, doctor, otra pregunta ya que estamos en cicatrices. Me preguntan, en cicatrices hipertróficas, en la misma sesión, ¿puedo combinar el neodymium NDYAG con el láser de CO2? ¿Y cuál hago primero?
Yes, you can, of course, you can, and you will use the neodymium NDYAG first. You always use the non-ablative first. You will use the neodymium first, and then you will use the CO2.
Para el doctor Saldívar, quizás es esta, si haciendo el tratamiento de onicomicosis con NDYAG, lo va combinando con medicación oral, o hace uno y después el otro.
No, en este caso lo combinamos solamente con la laca de ciclopirox y vamos ahora sí que realizando las sesiones mensuales, cuidando la higiene, pero solamente en estos casos no les hemos indicado tratamiento vía oral.
Bien, ¿y cuántas sesiones hace, doctor? ¿Cuánto sería el protocolo? ¿Se hacen mensuales, pero cuántas sesiones?
Generalmente les hacemos de 5 a 9 aproximadamente, ya según qué tan rápido vaya creciendo la uña. En ocasiones les mandamos algunas vitaminas, colágeno, biotina, para estimular un poco ahí el crecimiento de la uña, pero más o menos es el aproximado. Yo creo que el estándar es de 5 a 9, una por mes.
Bien, perfecto.
Acá tengo,
sí, a ver, Dani, ¿tenés otra?
Para el doctor Firas, sí, para el doctor Firas. Neus de Becker, angiomas maculares, ¿en rostro se puede tratar de esta forma? ¿Usted tiene alguna experiencia?
You mean spider angiomas?
Neus de Becker y angiomas maculares.
No, Becker's nevus, for the hair removal, yes. So Becker's nevus has two components. There is the hypertrichosis, which you can treat very nicely with NDYAG, because usually Becker's nevus is pigmented, so NDYAG is better than alexandrite. But for the pigment part of the Becker's nevus, I use the Pico or the Q-switch. For macular angiomas, if you mean just cherry angiomas or small capillary hemangiomas, yes, of course, you can use the NDYAG. You will use the 3 millimeter spot, and you will use a 20 milliseconds, and you will use a fluence that gives you that color change. So you can, of course. And remember, I told you that for vessels on the face, the Gentle Max Pro has a 1.5 millimeter spot. The 1.5 millimeter spot is only for the NDYAG, is not for the alexandrite, is not for the 755. So when you have the Gentle Max Pro and you have a special spot size 1.5, that's just for vessels on the face. So you can treat a telangiectasia. Maybe if it's even a very, very small angioma, you can try the 1.5, but I usually use the 3 millimeter spot.
Doctor, ¿puede pasar parámetros para tratamiento de varices de color azul o verde?
Yeah, okay, look, this is really a very big topic, and it depends really on the skin type, the anatomic location, underlying skin diseases, venous insufficiency. So it's very difficult to give precise settings for these cases. But I will make it easy. I will say you can start with the 3 by 10 millimeter spot, which is the linear elliptical spot. That is a good start. It's a safe start for the individual vessels. And then you select the pulse duration. For anything green, you start 40, 50 milliseconds, okay? Minimum. Don't go below 40 for the green. And for the blue one, 30, 40. And then really the fluence, that will, again, depends on the anatomic location, depends on the skin type, but you want to see a reaction. You want to see a color change, a little contraction. So that is something that, you know, once you get the wavelength, we're going to have to do a different discussion based on the clinical cases. But what I would say is you can use the 3 by 10 millimeter spot size or the 6 millimeter spot, okay? And for the green and the blue, for the blue 30 to 40 millisecond, for the green 40 to 50 millisecond to start with. And then the fluence will depend on the clinical endpoint. And one thing to add, I very much agree with Dr. Zaldivar that, you know, once again, Dr. Zaldivar is using the microsecond mode for onychomycosis. And the reason we use the microsecond mode is we generate heat. So I just want you to remember one thing from this webinar. Microsecond means we generate heat. When we generate heat, we don't want to lose that heat by cooling because, you know, we lose that heat if we cool. What is the point? So I totally agree with him. We use no cooling when we use microsecond because we want to get heat, but the heat is not going to be on the surface because the pulse duration is very short. The heat is going to be deep in the dermis where we want it. So not just like Dr. Zaldivar said for onychomycosis. Anytime we are using the microsecond NDYAG, we don't use cooling. I mean, because otherwise it defeats the purpose. Okay. Danielle, any other questions?
Okay. Sí. De la doctora Dora, la doctora Dora de Panamá, doctor, dice si puede utilizar el láser para hidradenitis cuando está activa o debe tratarla primero y remover el pelo cuando no está activo.
No, you can combine with active. And the studies that have been published have used the NDYAG also in the active stage, in early stages 2 and 3. So yes, you can combine when it's active. And you can even combine when they are on Humira, which is adalimumab, which is the anti-TNF biologic from AbbVie, which is now approved for hidradenitis suppurativa. You can even treat when they are on isotretinoin or acitretin. It's not a problem to treat even in the active stage. It is not an infection. It's an inflammatory response. And you can combine that with the oral or biologic treatments.
Perfecto. Doctor, otra pregunta sobre cuántas sesiones se necesitan para las telangiectasias azules de rostro. Debe ser las que mostró en periorbital. Debe ser que se refiere a esa.
Is that for me or Dr. Zaldivar?
No, para el doctor Firas.
Okay. Oh, the periorbital vein.
Doctor Firas, sobre cuántas sesiones.
One maximum 2 sessions.
Perfecto.
For the periorbital veins,
Perfect.
1 maximum 2 sessions. It is all about the clinical endpoint. This requires skill, but it is very, very satisfying once you know how to do it. But usually 1 maximum 2 sessions.
Perfecto. Doctor Zaldivar, qué pregunta. Debe ser alguien que lo conoce. Dice, entre Gmax Pro y Norlis, ¿ha visto diferencias o ventajas para el tratamiento? Debe ser con el uso del NDYAG, de ambos láseres.
Sí.
¿O cuál es el que más utiliza?
En el caso de mi plataforma Norlis, precisamente como ya tengo el láser, el NDYAG de pulso largo en el GentleMax Pro, no compré la pieza de mano del NDYAG de pulso largo, solamente tengo el Frax 1550 y las piezas de mano de luz pulsada.
Perfecto.
I can answer. The NDYAG on the Norlis doesn't do microseconds. It doesn't. It has a long pulse, but it does not go into the microsecond mode. And this is why it's important that you know which NDYAG you choose, because many NDYAGs will just give you a long pulse. But the advantage of the NDYAG and the GentleMax Pro is you can have a very long pulse or you can have a microsecond pulse. So this is the key difference. The NDYAG with Nautilus will not give you microseconds. So everything that we talked about here in the microsecond is going to be difficult to do.
Perfecto. Doctor Firas, en el rejuvenecimiento del NDYAG, al combinarlo con el HIFU, ¿qué tiempo debe pasar entre el láser y el HIFU?
You know, okay, look, I normally would say give it a couple of weeks. You could do the HIFU and then do after 2 weeks, just medico-legally, really. But in Korea, I was at a meeting in Korea, and I discussed with some Korean colleagues. Some of them do on the same day, the same session. They will do HIFU, and then after a few minutes, they will do either the radio frequency or the long pulse NDYAG in the same session. So you can combine also in the same session. They are working on different levels.
Perfecto.
Dani, acá hay otra pregunta que es para el doctor Firas, que dice, en telangiectasias de nariz, ¿cuántas sesiones le lleva?
1 or 2. 1 or 2. That is the beauty. Okay. That is the beauty of the 1.5 millimeter spot, or even the 3x10, is when you choose the pulse duration correctly and you start choosing the fluence, you must see something in the vessel. Either the vessel disappears, or the vessel shrinks, or you get a color change. 1 or 2 sessions.
Otra pregunta para el doctor Firas es ¿cómo sería el tratamiento de melasma con el neodimio NDYAG cuando queremos evitar el sobrecalentamiento de la piel en esos casos?
Yes, that's a good question. That's a good question. Is whatever you use for melasma. Okay, first of all, melasma is a big topic. Laser is not going to be the first line intervention, for sure not. You will start with creams and with some protection. So that's the first line treatment. But even now there are reports, and I have started combining lasers with oral tranexamic acid. So let me make it clear. When you start patients with melasma on oral tranexamic acid, doesn't mean you cannot combine with lasers. But the key thing is, whether I use the pico, the nano, or the microsecond NDYAG, after the treatments, I do use some cooling. But so during the treatment, it's the idea is to just get that dermal remodeling. So to improve on the dermis, improve on the vascularity of the dermis. And we don't want the cooling at the same time because it will affect the results. But then after the treatment, once we choose the right parameters and once we do the treatment, afterwards we cool. So cooling afterwards is different from cooling during the treatment. But yes, I agree, cooling is important with melasma always, but the reason why the microsecond NDYAG is being increasingly used is because we know now with melasma that there's also a problem with solar elastosis, there's a problem with dermal vessels and capillaries. In fact, the best thing to do is to use a dermoscope, okay, and look under dermoscopy for the melasma. If you see the telangiectasias, you see the vascular component, you really need to either combine with the V-beam pulse dye laser or with a microsecond NDYAG because you're also going to target the vascular component. Daniela.
Muchas gracias. Doctor Firas, para tratar varices, bueno, también sobre la protección, ¿utiliza protección de gel frío sobre la piel? Supongo que es posterior. No especifica.
I mean, look, afterwards, yes, we use aloe vera gel, panthenol. So panthenol and aloe vera gel as a cooling. But if it's for during the treatment, there actually was a study looking at whether you use the gel or without gel. It doesn't make much of a difference, even for hair removal. So we don't routinely use the gel if we're using the contact mode NDYAG. We don't. But cooling gel afterwards we use. But maybe we can ask also Dr. Zaldivar what he does also. We can also get his opinion. Dr. Zaldivar?
Nosotros utilizamos en el tratamiento, cuando utilizamos para el NDYAG para varices, utilizamos el enfriamiento posterior. Al finalizar el tratamiento, básicamente ponemos packs de hielo, ponemos alguna crema de hidrocortisona y básicamente sí utilizamos el enfriamiento, pero posterior al tratamiento.
Okay.
Yes, you know, that's an important part about the topical steroids. I routinely give skin types, you know, 4 and 5 topical steroids for 3 to 4 days. It's absolutely safe. It will not cause atrophy, will not cause problems. Many colleagues in Asia do it, in Thailand and in Singapore. It's routine practice. So for if you have a skin type 4 or 5, you treat with NDYAG and you're worried about any post-inflammatory hyperpigmentation, cooling is important afterwards. Topical steroid, I give them for 3 days almost routinely, and I reassure them it's safe. Daniel?
Ok, gracias. Doctor Firas, otra pregunta. Experiencia de uso de láser
You know,
con
Saturday I don't do a clinic.
simultáneo en acné.
Sorry, I can't hear. Okay.
Repito.
Okay.
Repito la pregunta. Ok. Experiencia del uso del láser con medicación en simultáneo para tratamiento de acné. Debe ser medicación para acné.
Yeah. All the time. Absolutely fine. Now, it depends on what type of treatment. Are we talking antibiotics or are we talking isotretinoin? For antibiotics, for sure. I mean, the antibiotics are only, some of them are only photosensitive in the ultraviolet light, not in the infrared. If we are using the 1064 microseconds mode, this is infrared wavelength. It's not the photosensitive of the antibiotics. And there are many articles combining the minocycline or doxycycline antibiotic with lasers in acne. It's absolutely fine and absolutely safe. If you're talking about isotretinoin, then that depends on the settings. Has to be a little bit lower. Okay, there can be a little bit increased sensation, and sometimes they're a little bit more sensitive. The skin is a little bit more dry. Okay, and you need to just check with your medical legal team or with your insurance in your own country whether that is possible or not. In some countries, they don't allow you to use any laser if a patient takes isotretinoin. In some other countries, it's a bit easier. So if it's isotretinoin, I generally tend to avoid unless I really need to, but I generally tend to avoid. But for oral antibiotics, minocycline or doxycycline, absolutely not a problem. And there are studies and reports that show synergism and better results when you combine the oral antibiotics plus the lasers. Daniela.
Bien. Para el doctor Zaldivar, preguntan si antes de iniciar el tratamiento usted hace algún tipo de cultivo para saber de qué hongo se trata.
Principalmente, bueno, la mayoría de los casos el diagnóstico es clínico. En pacientes que ya tienen tratamientos vía oral previos que no han sido exitosos, les pedimos el KOH y les pedimos el cultivo, pero yo creo que en el 80% de los casos el diagnóstico es clínico.
Bien. Doctor, y antes de comenzar el tratamiento, ¿usted recomienda limar la uña?
No, de hecho, precisamente lo que les recomendamos es eso, de que no se escarben las uñas, de que no las limen, que no las raspen, porque precisamente lo que he encontrado es que posteriormente es más doloroso el tratamiento, sienten más el calor si llegan con la uña limada o rebajada.
Ok, perfecto. No sé, Dani, si vos tenés alguna pregunta más para hacer.
Bueno, acá hay una pregunta puede ser el doctor Zaldivar, puede ser el doctor Firas. Ejemplo de costo de sesión del láser para onicomicosis, si lo quieren decir.
Sí, claro. Nosotros aquí en la clínica cobramos 1,900 pesos, que vendrían siendo cerca de $100 por área, ya sea pies o ya sea manos. El costo es por sesión.
Ok. Okay.
Yeah, we charge a little bit more, but living standards are a little bit higher and it's more expensive. So we charge around $300. But again, that depends on whether you're doing a package or not, since you want us to disclose. So, you know, like sometimes if we're treating a treatment for $300, but if we think, for example, in diffuse redness, in acne, they may need few sessions, we give like a package. If they have 3 treatments, we give a little discount. That is only to just, you know, make it a little bit more attractive and easy for patients, but also in all honesty is because all our competitors and all the clinics and doctors are doing the same. So, you know, we want to just adjust our practice to the others. Daniela?
Ok, ya creo que es de las últimas preguntas. Doctor Saldívar,
Sí.
¿usa también onicomicosis con cándida?
Sí, hemos tenido éxito en onicomicosis con cándida, con cultivos positivos, siguiendo el mismo protocolo que les hemos mencionado, combinado con la laca, con la higiene, y sí hemos tenido resultados positivos. En ocasiones no la curación al 100%, pero sí hay una mejoría clínica de la uña.
Perfecto, muchas gracias. No sé, Fer.
Ani, ¿y siempre viste siempre una pregunta que nos hacen tanto a vos como a mí? Es, ¿cuánto se cobra? Quizás esta sea para el doctor Firas, el tratamiento cuando uno tiene que hacer, por ejemplo, unas telangiectasias de nariz o unas telangiectasias faciales, que viste que siempre es una pregunta que nos hacen de cuánto, no saben cuánto cobrar.
I mean, look, I'm not sure whether the prices in London are necessarily helpful for Latin America, because obviously you're dealing with a different economy and a different population. But I can make it simple and tell you that we do not do anything below $250 American. So nothing cheaper than $250 US, because we feel that we're having the right equipment. The treatments are done by a doctor. It's the doctor's experience, doctor's time, and with the good equipment. You know, even I might be in London in the United Kingdom, but we have many clinics with very poor, cheap laser technology, and they are treating very, very cheap. We don't want to compare ourselves to them. So we start with $250 and it goes up. But that is, you know, the starting point. If that is helpful for you, then that's fine.
Could we get Dr. Zaldivar to comment as well? Because I think that would be interesting from Mexico.
Sí, en el caso de México, pues la onicomicosis, la mayoría, yo creo que a lo mejor un 50% de los tratamientos de los pacientes que tratamos, pues son pacientes de no tantos recursos. Entonces, como menciona el doctor Firas, pues las economías son diferentes. Aquí un tratamiento más o menos de $100 es lo que los pacientes tienden a pagar, que se les hace accesible, y para que le den seguimiento al tratamiento y continúen viniendo a las sesiones. Que desde el punto de vista también económico, pues una sesión de $100 que no tienes consumible, que te tardas un tratamiento de unos 15 minutos, realmente aún a pesar de que es un precio realmente bajo, el tratamiento continúa siendo muy redituable.
Perfecto. Doctor, ahí para el doctor Saldívar.
Can I make a point? And this is a very, very important point. I think I thank Dr. Zaldivar. But if we are going to talk business and we're going to talk money, I think you have to take into consideration the demographics. So I have visited some clinics in Latin America, and you know, it is common that the clinics are busy. They see many, many more patients. Patients are a little bit willing to wait, and you can spend less time with the patients. The population in Latin America is much more forgiving and expects, you know, they don't want to take too much of the doctor's time. It's different in London when the patient, you know, wants half an hour of your time, and I can't see 40 patients a day. I just can't, because the type of patients I see is probably, Walter, is similar to downtown New York. You know, they want attention, they want time. So our prices reflect that. So don't look just as the price. So Dr. Zaldivar may be charging $100 US, but I'm seeing half of the number of patients just simply because these are the type of patients who want this kind of attention and time. So my charges are higher. So I think at the end of the day, you need to see how many patients can you treat a day and what business model or pricing suits you the best. So one of the models that works for me is I see less patients, but I charge higher. And that means I get a happy patient and I am not disadvantaged financially.
If I can make one point, in that return on investment that we put together, my brother is a physician, very successful, knows nothing about business. So I get dragged in every time to help him out. One of the things you need to consider as a physician in constructing these return, whether it's my laser, another company's laser, a procedure, is what do you need a room to generate in revenue per every 15 minutes, per every half an hour. And that helps you price things out. One of the things in that ROI, for example, is how long each procedure is. So when we look at pricing, and again, my laser, another laser, it doesn't matter, and we're building this ROI and we're deciding whether an investment is good, is how much time does each procedure take? And that's why, and which person in the office will be doing the procedure. So it's never an easy answer, and that's why we try and put these things together, and I send them to my distributors, and they change the numbers for the local markets and economies. So that's another thing to keep in mind is the time. It's an excellent point. Thank you both for answering that.
Thank you. I totally agree, Walter, because, these prices are the prices that is my time. So it's doctor-led treatment. I know in some cases it's delegated. When you delegate a treatment, that's when you can probably charge less and get the numbers. But if I'm as a doctor, as a dermatologist, if I'm giving my time, then I need to charge for that. Daniela?
Perfecto, muchas gracias. Fer, creo que, acá hay una, puede ser para los dos. Una anteúltima pregunta. Respecto al dolor para el tratamiento de uñas, ¿suele doler más y qué diferencias en eficacia con el Q-Switch de NDYAG? Si alguno de los dos tiene experiencia.
No, yo en mi caso no. Lo hemos intentado, no ha habido mucha diferencia en cuanto a dolor, pero principalmente utilizamos el Gentle Max.
Yo tengo acá una última, Dani, que es para el doctor Saldívar, que si podía repetir el nombre de la laca que utiliza el paciente durante el tratamiento de onicomicosis.
Sí, acá en México tenemos la marca comercial es NDYAG, viene siendo ciclopirox al 8% y se aplica por las noches y les recomendamos el cepillado o lavado de las uñas por la mañana.
Perfecto. Yo, Dani, no tengo ninguna más.
Hay una.
Sí, claro, es NDYAG y el ingrediente activo es ciclopirox al 8%.
Ok. La última para el doctor Firas. Usando NDYAG y triamcinolona en cicatriz fibrosa conjuntival tarsal, post-extracción de chalación.
Oh, I don't use it. I don't use it in the conjunctiva. I don't use it. I know that there is one company. That uses the NDYAG for the conjunctiva for tightening, but I don't use it. And let me be very clear: Candela also does not have a specification for conjunctival use. So let's be very clear about that.
Es verdad. Es verdad. Bueno. No tenemos más, creo que están todas, la verdad que eran por privado, sí. por privado y en general, y la verdad que...
No, I have a question.
Okay.
When am I coming back to Latin America? I want an answer.
Buena pregunta. Buena pregunta.
I need an answer. I've been giving lots of answers.
¿Te vacunaste? ¿Te vacunaste, doctor Firas, o no?
I received the first one. Yes, the first one. And I will receive the next one in April. So from May, I'm fine, if that's the question.
When Joe
Muy bueno,
Biden
acá
lets us travel,
estamos
I will
lejos,
call you.
Acá estamos lejos. No sé, el doctor Saldívar, si están vacunando. Sí,
No, aquí en México van un poquito más lentos.
Sí, igual que acá.
Pero esperemos que como para finales, supuestamente como para abril, mayo, más o menos ya debemos estar vacunados.
Bueno, Walter, no, por ahora no tenemos más preguntas. Agradecerles a todos, a los doctores. Te dejo las palabras finales, Walter. Walter.
Yes, let me just say, over 120 people attended. 95% of them stayed through all the questions. Dr. Zaldivar, Dr. Alnami, that only shows you that they enjoyed the presentations, but they also enjoyed you answering their questions, because I think it's very refreshing that they can just ask directly to you and that the companies stay out of the way and let you answer. Thank you so much for giving me your Saturday morning to my distributor team, to the over 100 doctors who attended. Awesome job. I'm very, very happy with this, and thank you. Thank you to NDYAG and Danny for all the work you did putting this together.
Gracias a todos.
Muchas gracias a todos.
Muchas gracias y buen día a todos.
Take care. The first drink's on me.